I think we are facing a period of massive challenges in medicine, probably at a dimension we never had it before. And this comes from multiple directions. The first one is the level of innovation due to new technologies we will see within the next 5 to 20 years. The second one is the aging population and limited resource. And when I say limited resource in healthcare, these are two things. It's the medical workforce that's aging, and it's the budgets. Those are the three dimensions. And if you look into those challenges, CME, as we know it from the past, will only give us very little answers to those challenges. I don't think that CME, as we know it today, would qualify to manage those challenges. From my perspective, learning needs to radically change into becoming learner-centric, problem-oriented, and outcomes-driven. So this paper originated by a group of experts from pharma because we saw a need to really evolve the quality standards behind medical education. There is a need to ensure that we use the time of our learners effectively and that we provide value with educational engagements that is driven by real educational needs, and that's what the framework is about. On the one hand, it's an essential element of the quality framework we suggested. And when we look into the competencies in the medical education industry, when we are screening, for example, partners and agencies, we see there is a big weakness in those two domains. One is instructional design, means which educational format to apply for which target audience and which kind of educational need. And the second thing is how to measure the achieved outcomes. There's a fundamental difference whether we want to measure knowledge change, which happens in the educational setting, or if we want to measure change in competence, which is a demonstration by the learner, or if you want to get to higher levels, be it performance or even patient outcomes, that can only be measured in the environment of the medical workforce or with respective data from patients. What we see today is all kinds of measures that are intending to signal higher level outcomes, but most of them apply only for knowledge change or even lower levels. It needs to be based on some fundamental elements we have defined. That's needs assessment, instructional design, adult learning principles, transparency, balance, and outcomes evaluation. The way how this is executed, there may be variations dependent on the environment. So we have environments like developing countries or emerging markets where there's not the resource to put as much effort into this as we would do it in the developed world. But the underlying principles, those should be the same, independent on the environment. What I find really interesting and exciting is that I see a gradual increase of the proficiency level and level of professionalism in the CME environment from year to year. Especially in yesterday's debate, we had a very open and trusted exchange from various perspectives of parties that are involved in providing education or accrediting education, be it independent medical education providers that work for industry itself, medical societies and accreditation bodies. We also see that there is a serious attempt to increase the impact of education and to develop the respective competencies and expertise. So the dialogue we are facing today is around quality and much less about experts teaching others. It's moving towards the learner as the center of interest, why we do the learning, but also as the beneficiaries of the learning. And that's a very positive direction.